So I'm really, really looking forward to today because I've got Heather Batey with me, and she doesn't need any introduction, but I'm going to introduce her anyway. Heather is the founder of Reach Brain Injury Rehabilitation. She's a neuro OT by background. You have to jump in, Heather, if I'm getting any of this wrong. And we're going to talk today about, well, everyone knows, we're going to talk about the link between mental health and traumatic brain injury, which is super interesting. We've had a chat before, Heather. I've learned loads already from you, but we've got so much to talk about. I'm going to just dive in, if that's okay. Welcome.
That's absolutely fine. Go for it.
Thank you for being here. So I kind of alluded to this at the start, but we've just come through January and it was long, and I kind of thought this was an interesting discussion to have at the beginning of February, because January is for lots of people a really difficult month, isn't it? You know, we can all joke about how it goes on forever, but actually it is a really difficult time for lots of people. And I wanted to I thought it was just a good opportunity just to springboard off that. But I think the most important thing for us to start with, Heather, is some of the stats to kind of looking at this correlation. Maybe you can just start off by giving us a bit of insight.
Yeah, I think that's a really good place to start, actually, Emma. Thanks very much, and thanks for inviting me on today. So I pulled together some figures for you, some facts and figures, because I think that really does set the scene about the whole mental health and TBI issue. And I was at the International Brain Injury Conference in New York in September, and that was really much the focus of the conference, was TBI, mental health, and how that affects people and the treatment of those people going forward. And we know as clinicians that the majority of our brain injury clients will have some form of mental health issue following their injury. And the statistics really do back this up, Emma. So just some statistics for you. About 80% of TBI clients will suffer mental health issues going forward. That's a given. That 80% is a really high number. But to bring that into a little bit more context, about 50% of those will have significant depressive symptoms within the first year post-injury, and that gives them a more predisposed position to suicide risks as well. But also about 2/3 of patients will have mental health issues and depressive issues within the first 7 years. Now, those figures are pretty high, but if you couple that with 50% of the depressive figures, those clients will have anxiety issues as well. So it's a bit of a mixed bag. Yeah. And those figures are super high. Just to give a little bit more detail to that as well. So 40% of mild TBI clients, concussion clients, will have ongoing mental health issues, 40%, and that's meant to be a mild injury. And then you've got a few other little things thrown in there. So about between 11 and 34% of TBI clients will have more aggressive and behavioural issues, and that in itself will lead on to psychological problems and mental health issues going forward. And then we mustn't forget about insomnia as well. You know, 60% of our brain injury clients will suffer a level of insomnia throughout their recovery journey. And if you've got lack of sleep and insomnia issues, then this leads to less resilience, doesn't it? And that will then have more of a predisposition to mental health issues. So actually the figures are staggering and quite kind of multifaceted, aren't they?
They're kind of horrifying, actually, Heather, the actual stat. I mean, yeah, it's kind of tried, isn't it, to say that when we think a lot of our brain injury clients have mental health problems, and you kind of don't really apply your mind to that. But I think those statistics are pretty, they do focus one's mind on the issues. What I'm kind of interested in is kind of just digging, I suppose, a wee bit deeper into the stats is, you know, I'm thinking about the patterns. Mm-hmm. So are mental health issues more prolific amongst certain groups, ages, genders?
Yeah, quite interesting. And to be fair, the research out there fluctuates a little bit, but most of the studies show, and this is really backed up by clinical case studies, that the prevalence of mental health issues is higher in men as it is in women. That's a given. However, there was a recent review just over the last couple of days I saw on LinkedIn that women having had concussion were experiencing more severe and longer term mental health issues following concussion within the sporting world. And that was quite interesting because the prevalence is higher, but also the symptoms are longer. So there's a little bit of a mixed bag out there, but the general statistics do state that men suffer more than women from mental health issues going forward. Yeah. And go on.
No, sorry. I was just thinking about, because the conversation about mental health is kind of, it's a bit more out there now, isn't it? And because of social media and all that stuff that we know already. And I was just wondering, it's interesting thing, you know, I was reflecting upon ages and, you know, is it that, are young people more ready to talk about it? Is that a thing, or?
Yeah, but again, a bit of an interesting kind of process on that. So again, the statistics show that mental health issues are more prevalent in younger male, younger individuals as opposed to older. And when I say younger, I mean kind of under 40s. So kind of you and all your colleagues, and I'm a little bit safer because I'm on the other end of the scale. But there is the issue of resilience as well. And I think younger people are maybe more in tune with the mental health issues. There's more out there about the need to talk, the need to access services, the need to look after yourself, rather than the older cohort perhaps.
Yeah.
But certainly it very much is a case of the younger people are struggling more longer term. But also the suicide rate is higher in younger men as well, following traumatic brain injury.
So sad,
but there is an awful lot more out there, and you see on the likes of social media, people charting the progress through mental illness, and that's been really inspiring for a lot of people as well. So I think that's really helpful.
There are so many blogs and stuff about it now that you can kind of fall down a bit of a rabbit hole, you know, looking at all of these amazing blogs by people. It's so fascinating. Look anywhere on Twitter, you'll see them. Yeah. Anyway, I'm going to ask you a really obvious sounding question now, Heather, and I hope you don't mind, but I'm interested as to why people who've experienced TBI are seemingly kind of more susceptible to those mental health problems. And I know that you could probably spend an hour talking about that.
Yeah, one of the obvious answers, I guess, for that is that somebody has a brain injury. Their life suddenly changes from being independent, being able to do what they want when they want, call the shots, make plans, achieve goals, to suddenly not being able to do that. And again, the research based, a lot of it, this was from the New York conference as well, was that these clients will suddenly realise that they can't do that, and they're comparing themselves to what they were like pre-accident, and that in itself is enough to have a mind shift, isn't it, on how you view yourself, your life going forward. Yeah. And it's not just the physical aspect either. A lot of people compare themselves physically pre and post accident, and that's bad enough, but also comparing in terms of deficits in executive skills and cognitive skills, so that if your memory is not so good, or your concentration, your attention is not so good, or your planning and organising skills are not so good, then you're going to stop doing the things you were doing before because you're comparing yourself to pre-accident. And you can see how that manifests in terms of low mood and then high anxiety. Yeah. And then that linked together really looks to see how somebody will adapt and compensate for their changed sense of self. And I think the key important point there is really to look at how a client can view themselves now and how they can help move themselves forward positively. And I think a lot of the research and a lot of the focus out there now is all on wellness. So instead of identifying the deficits, it's identifying the wellness inside, looking at how well you are in certain areas and how you can enhance that. And the aspect of wellness was a real buzzword in quite a lot of the research that you look at now.
Yeah. And again, I feel like the next question to ask is kind of obvious and silly, but if we think we've talked about and we know about thinking that kind of TBI and mental health are kind of inextricably linked, and with one comes problems with the other and what have you. But is it from a treatment perspective, and I'm thinking of kind of practically, how important is it to separate the two, to separate the TBI and the mental health issues? And practically speaking, Heather, at what stage should we be looking to kind of zone out those mental health problems and look to treat them?
Again, quite a tricky route to navigate, isn't it? But the evidence absolutely depicts that you look at the mental health issues first, you address the mental health issues, and then you bring in the neuro rehab elements afterwards. And so this is not just a case manager neuropsychology approach initially. It's really looking at getting the right services in at the right time. And that's where a good case manager comes in, because they're like the conductor of an orchestra, making sure the right services are in, the right clinicians, the right professions at the right time. And the evidence suggests that you absolutely approach the mental health aspects first, and then you look at the neuro rehab needs following that. So initially, with the mental health issues, you might be looking at neuropsychology, clinical psychology, CBT, maybe neuropharmacology, neuropsychiatry, in order to enable a client to get to a stage where they can accept and work with rehab strategies. Otherwise, there's no point. So there's often cases where we would be referred a client where maybe perhaps the mood was very, very low. And there's no point in us working with a client from a neuro rehab strategies point of view, because they're not going to take on those strategies, Emma, and they're not going to be able to work with that and improve and benefit from it. They need to be in a better place in their own mental health in order to do so. So absolutely mental health issues first, then looking to get the MDT involved in order to be able to help them work with the strategies. But there has to be a link between the two, and the case manager is the key person to do that, and making sure that there's common ground and shared goals. That's really important.
Okay.
But it's not just the client either. And when we talked before about, you know, why are people more susceptible? We have to look at the family as well, Emma, because a brain injury doesn't just affect the client, it affects the whole family, as we know. And if the scaffolding and the support from a family is poor, then that's going to be harder for a brain injury client to move forward.
To manage that, we could do a whole different, in fact we'll do a whole different episode on the wider family stuff, because it's so important. I also was wondering about kind of the correlation in terms of severity, Heather, between mental health problems and whether there is one, the severity of mental health problems and the severity of brain injury. So in other words, those with a higher level brain injury, they have more severe mental health problems. Is that?
Yeah, there's a whole host of different issues that could be pulled into play here. Typically, the evidence suggests that the more severe the brain injury, the more likelihood of having longer term, higher level mental health issues that need to be dealt with. However, we see a lot of clients as well with mild TBI, and I think that sometimes the mild TBI and mental health issues get kind of sidelined a little bit. So we see a lot of clients with post-concussive syndrome with mild TBI, and although their symptoms are subtle, because of the good awareness, good insight, then their mental health issues are a little bit more profound, because they're not being able to do the things that they could do beforehand, and it's very, very much more trickier for them to be able to navigate that. So in some ways, the more severe brain injury, the more likelihood of mental health issues, but that doesn't mean to say that the milder ones don't have those issues as well. I think we need to be really aware of where the red flags are across the board.
Yeah, and we do see a lot of the time, don't we, where people that have those kind of mild, subtle TBI, that there's often kind of out there less understanding of what that means and how that impacts people. And I think other people's ability to empathize and kind of relate is difficult, adds another layer of complexity, doesn't it?
Absolutely, you're absolutely right. And also for those clients and families, because often these clients haven't had a period of unconsciousness, so they don't understand what's going on and why they're feeling like this, and they don't have the right to feel like this because the injury wasn't severe, and that's nonsense. It's nonsense. Another thing we could talk about all day. We've just crammed about 25 topics into one 15-minute session.
So what about other factors then, Heather, thinking about hormone balances, fatigue, all of that sort of stuff? How does that all play a part?
Yeah, I think, as clinicians, it's really tricky for us to be able to unpick everything, but that's what we must do, because that gives us the best shot at having a good baseline from a client to kind of move forward from a rehab program. So other impact things are the severity of injury we talked about, and pre-existing mental health issues that can't be underestimated. If somebody's quite low mood, quite depressive, or quite high level of anxiety pre-accident, that's got the ability to be magnified post-accident, and then that's something that we need to be dealing with. Coping skills, coping strategies, that's really important to know whether how they cope with skills and how they cope with difficulties. If they've got poor coping skills, that can have a risk of developing poor mental health post-accident. Social support system, really important, but medication as well. And also, I would love to talk about hypopituitarism, but we're just not going to have time to do that.
No.
But that's key, and that could be a whole different differential diagnosis as well.
Yeah, it's all that. It's kind of process of elimination in the early days, isn't it, to some extent?
Yeah.
Which is really tough, really hard to do. Final thing. About 30 seconds there.
Go for it.
Just to kind of mention interventions, and I mean medicinal, other, you know, what really are the options, and what sort of things should we be keeping at the forefront of our minds?
Yeah, I mean, really what we were looking at from an intervention point of view, you've got your neuropsychology, you've got things like neuropharmacology, so neuropsychiatry, in order to look at moods and anxiety. EMDR is out there. Sometimes people think that works, sometimes it doesn't. You cannot underestimate the power of exercise. Exercise is massive, and another topic to talk about. OT, looking at goals, strategies, looking at aims and targets, and also sometimes speech and language therapy can come into play in terms of language skills and knowledge. And so a whole host, but again, you go back to a good case manager who knows what they're doing, getting the right clinicians in at the right time to identify those symptoms in order to get a client to a level that they can take on board rehab strategies.
Yeah,
so it's important for that.
You always want to do everything perfectly, don't you? For every client, you always want to do everything perfectly from the beginning, catch everything really early, unpick all of the issues, but that's just not reality, is it? Because a lot of these issues actually come out down the line, and people might experience a dip in their mental health kind of a year into post-injury, because maybe their insight has improved, or it's really kind of it's so difficult to keep on top of every single issue and unpick them. But I suppose the message is we just do it as best we can, as early as we can, and just be aware of those, really quite difficult to swallow statistics that you mentioned at the start.
Yeah, but also if a case manager is involved or a clinical team are involved, they can pick up on what the red flags are, and also equip the client and the family with the strategies in order to manage and have a pathway for them to be able to follow if those symptoms get to a point that they need to be seeking further help and support. So help is out there. It's just making sure that we empower our patients with the skills in order to either access them or implement them.
Yeah, and anticipate things as well. It's so hard. I mean, we should have booked in a longer slot, really, but we've run out of time. But thank you so much, Heather, because even just a kind of a small insight into these issues is so helpful and so important. Just reminds us all to reflect upon the issues. So thank you for that.
Thank you so much for inviting me on.
No, it's a pleasure. Thank you everyone who listened.